Insurance does also not equal, therefore, more legitimacy. It is simply a business model making a decision that ultimately provides more profit and revenue to the insurance provider. Whether you're in a big hospital system or whether you're just owning a private clinic taking insurance, you are literally handcuffed to that insurance company. You have no real authority when it comes to treating your patients as you see fit. It's going to deny coverage. It's not going to allow you to write for a new medicine that could be much better for your patient. It's going to allow you to write for some crappy old medicine that costs, again, pennies on the dollar. Insurance does also not equal, therefore, more legitimacy. And I think this is the culprit in a lot of ways, too, of what patients experience or providers experience. If insurance covers it, it must mean that it's good, right? That's like a moral claim. If insurance does not cover it, it must mean it's not legitimate. Must mean that it might even be bad or like not safe. What's a good example of that? How about instead of me getting labs checked for testosterone and maybe even my insurance covering that, which a lot of times it doesn't, because I'm feeling depressed or anxious as a male, and we know that testosterone is associated oftentimes with poor mental health, but rather an SSRI is easily prescribed and highly covered by insurance. Now that is more legitimate than the testosterone, even though the studies do not show in any way, significant way, shape or form that SSRIs really significantly outcompete testosterone replacement therapy. And we've never really done a good head-to-head there. How about a young female who, I'm talking young female, like teenage, suffering from really severe menstrual cramps, some migraines and things of that nature around her periods and around her cycles? How about the fact that we dole out birth control, which is essentially a chemical castration for these young women? And again, I'm not disparaging anybody who provides birth control or feels certain ways about birth control, but I'm just simply stating a fact, which is that birth control literally shuts down a female, especially a young female's production of her own endogenous hormones, and instead inserts these non-identical hormones, which are also highly associated with and causative of cancers and clots and strokes, and the list goes on and on. Now, for some reason, progesterone is seen as a non-viable option, not always as covered by insurance, not nearly as much as, say, birth control, which is like pennies on the dollar. And so what it creates is this, for both providers and patients, in my humble opinion, it creates a dissociation almost with what is legitimate and what is not. What is morally and ethically right for me to prescribe and provide to my patients, and what is not. And so if insurance denies coverage, what I need you to understand is it is not because of legitimacy. It is simply a business model making a decision that ultimately provides more profit and revenue to the insurance provider. If I'm Anthem Blue Cross and Blue Shield, I would much rather a female patient be prescribed a very cheap and affordable medication like a birth control, an oral birth control, than potentially a slightly more expensive bioidentical progesterone. Do you see what I'm saying? The way the business is set up is to deny coverage, not based on moral and ethical values, is to simply deny coverage to things which are more expensive to those patients because the insurance does not want to spend more than it has to. And we all know that. That's not like news to us, right? We complain about that all the time, patients and providers alike. But you can see where that can get twisted then all of a sudden, because it has this, you kind of just naturally make an association between what is covered and what is not, what is legitimate and what is not. And I think that's disastrous. I really do. I want to highlight another point here, which is that if you are a provider and you are providing care via health insurance, again, I'm not disparaging anybody here. I really don't want you to take away from this whole podcast that I'm like, shitting on you because you're a provider taking insurance. Like I did the same thing for a long time. Okay. So like I am one of you. I was in that system for a long time. But what I want you to understand is that you really don't work for your patients if you are providing health insurance. You work for insurance companies. How do you get paid otherwise? I mean, sure, there could be some like copay stuff from patients, whatever. But that's few and far in between, guys. The vast majority of your revenue, your profit, whether you're in a big hospital system or whether you're just owning a private clinic taking insurance, doesn't really matter. You are literally handcuffed to that insurance company. They are paying and footing the bill, so to speak. Does that not also mean that it's the golden handcuffs? Well, absolutely it does. I mean, if you're making $250,000 a year as a psych provider, you're doing hard work, you're working hard, you're seeing lots of patients every single day. I get it. Like it's hard to step away from something like that. And yet you have no real authority when it comes to treating your patients as you see fit, because that insurance company can very much dictate how you do that. Number one, the easiest way it can do that is simply by denials. It's going to deny coverage. It's not going to allow you to write for a new medicine that could be much better for your patient. It's going to allow you to write for some crappy old medicine that costs, again, pennies on the dollar. Is that not a barrier to you as a provider? Now, does that not get in the way of your moral and ethical duty to the patient? I think it does. I actually think that, seriously, insurance is probably if we want to talk morals and ethics, again, insurance itself isn't doing this. It's not like some evil cabal, I don't think. I think it's mostly that the way the business is set up, the model, this is just the way the cookie crumbles. You are beholden to the insurance company. You work for the insurance company. They pay your salary. They put your food on the table. They keep the roof over your head. It's not the patients. The patients are kind of like the feeder almost into that system. The insurance is the middleman, right? It gets to dictate all of that stuff. And I think that's the danger. It's the golden handcuffs. It's what creates burnout. Burnout is rarely, I mean, seriously, it's rarely an effect of, working too hard, seeing too many patients. That is a facet of the problem. I'm not denying that. But I know a lot of providers who can work their tails off. Most of you are really hard workers, like unbelievably hard workers. If you're like a nurse and you became a nurse, like you've worked hard your whole life. Same with MDs, PAs, I don't care who you are. You have worked really, really, really hard. You're not shy of hard work. What the problem is when hard work, which you are doing anyways as a provider, it's very draining. I get it. When that is now also misaligned with your moral and ethical judgments. So not only are you working really hard, but morally and ethically, you're in a business model that does not reflect your alignment with your, dare I say, spiritual integrity. We got into this to help people and patients, right? That is the reason why we're in medicine. Why would we do it otherwise? Seriously. At the end of the day, I hope and pray that most of my medical providers, friends, colleagues, etc., most of them got into this because they believe that they were put here on earth by God to do amazing and incredible things for their community, to be healers. Seriously. Like, I would hope you would do this for free. That's how much you freaking love it. Most of us would. Most of us practically do. We're so overworked. The problem is that the misalignment, when that comes into play, all of a sudden now you're working hard to get paid what I think is frankly chump change for the amount of work that you're doing, only to then also feel this burden that you're not actually doing everything that you could be doing for each and every one of your patients, because insurance will get in the way. Whether that's denying coverage, denying a certain medication, a certain procedure, whatever. Insurance will find a way to get in the way. And it is not to do that in an evil way. It is simply because that's just the way the cookie crumbles. That's the way the model of the business works. And you have to respect that. You really do. You don't have to like it, but you got to respect it. Because if you're the owner of Anthem Blue Cross and Blue Shield, you're making some good money. So when it comes to cash-based medical systems, and just to be clear, because some people don't know this and it's like no fault of their own. When I say cash-based, I'm not literally saying like all patients do is give me literal green dollar bills. I'm saying cash-based as in there is no insurance. We cut the middleman out. It is not myself, Anthem Blue Cross patient, right? Or what any other insurance provider. It is just me and the patient. That's the transaction. It's not the patient to the insurance company to me. When we cut that middleman out, it might feel like this big, scary thing because that's just what we're used to, right? The narrative in the medical and healthcare community and for you as a patient or you as a provider would be that insurance is necessary to achieve all these things. Insurance is only necessary for extreme cases. Car insurance doesn't cover oil changes. It covers catastrophic events. If you total your car, something that's going to cost thousands and thousands of dollars to repair, you pay insurance for those events. And that is, in my opinion, I think the way insurance would work. I don't think insurance is necessary in many ways for primary care. That should be relatively cheap, $50, $100 a month. Direct primary care model. Right? We pay these small monthly fees and we get access to great care and really cheap medications. And by the way, really cheap procedures too. Like, what a win-win, in my humble opinion. The only thing I want to be spending money on insurance-wise is if I end up in a catastrophic event where I need to be flown by helicopter to a hospital and it's going to cost me hundreds of thousands of dollars, maybe even millions, God forbid, who knows what's happening to me. And I don't have to worry because I've paid my insurance premiums for that catastrophic insurance policy. You see what I'm saying here? Like the entire universe around insurance generally works that way. Insurance is not for little itty bitty piddly things. It's for big things. And so the cash-based system, it removes the middleman, which then removes the financial framework, the coverage denials, what you can and can't prescribe, what a patient can or can't do in terms of procedures. It removes that whole barrier. And it opens up something really meaningful because when we do medicine through a cash-based system, a cash-based business model, we then can realign with our value system, which is I am here to help patients achieve the best outcomes possible via whatever means necessary. Thank you so much for checking out this clip and tuning in. I hope you enjoyed it. If you really liked it, I definitely recommend that you click here to watch the whole entire video where I go into much more detail. Thank you again for joining, and I'll see you there.